Mark, tonight in Medical Rounds, it's a medical condition that affects millions of people. We're talking about glaucoma. Dr. Christy Mascarenas is an ophthalmologist at Hartford Hospital's Eye Surgery Center, and she's joining us live tonight to talk about how common this condition is and how it's treated. Good evening, and thank you for joining us tonight, Dr. Mascarenas.
Hi, thank you for having me.
Well, let's get started first with a question about what is glaucoma?
So that's a very good question for right now, since Glaucoma Awareness Month just ended. Glaucoma is a certain set of changes in the optic nerve, which is the part of our eye that carries information about what we see to our brains. When the pressure inside someone's eye gets too high for that particular eye, the optic nerve can hollow out over time. And what that does is it changes people's peripheral vision or their side vision. If glaucoma is never treated, you can end up with tunnel vision or sometimes even go blind.
Well, that brings me to my next question. You mentioned it could affect peripheral vision. How do people know if they have glaucoma? If you notice a decline in your peripheral vision, would that be a symptom?
So sometimes people don't actually know until their doctors tell them. There is one type of glaucoma called angle closure glaucoma that is really recognizable. It can give you pain, a red eye, very, very blurry vision all of a sudden. But the more common type of glaucoma, which is open angle glaucoma, people may not know until their doctors tell them. It's very hard to notice your peripheral vision changing over the years.
That's a good point. Now, what tests in the office are available to detect glaucoma?
So we can check people's eye pressure to see if it's higher than average. We can look at the drains in people's eyes to see whether they're open or blocked. We can dilate people's eyes to look at their optic nerves and see if those look healthy. And if we think you have glaucoma, there are other tests that we can do. We can do scans or photos of the optic nerve to see if it looks healthy. We can also check people's peripheral vision by doing visual field testing and see if that's normal.
All right, thank you. Some great information. Thank you so much, Dr. Mascarenas, for sharing this helpful information with our viewers tonight.